At the Mayo Clinic in Rochester, our respiratory therapists deliver the best care for the sickest patients every single day.
The first time I walk around Mayo, I knew I was the right place. And I also feel like I'm valued, what I contribute to the team, being acknowledged.
When I first came to Mayo almost 4 years ago, seeing everyone working here and being happy, I was convinced that this is where I want to be.
At Mayo Clinic, the needs of the patient always come first. And I think when we look at each individual patient, that's what we're trying to achieve. Our respiratory therapists here, I think, are great in that respect. I think they look at each patient individually, take what we've determined as best practice, look at that patient in that clinical situation, put the two together, and then bring forth that idea to the team as we round. I think they're the best advocate for the patient when it comes to the respiratory therapy needs.
That's one of the advantages, I think, of Mayo Clinic is that level of autonomy. You don't get it on day one, right? It's one of those things you kind of have to earn once you sort of join that team. You know, Mayo as a team, once you have that kind of mentality, that door opens up. And that's one of the things that's special, I think, about Mayo is the trust.
So in my role as a neonatal pediatric therapist, we intubate. We're the ones that do the intubations. We run the vent from day one. So we're the ones that put in the tube. We're the ones that run the ventilator. We continue their care after that. We're with you 100% of your stay.
One of the things that has been really great about Mayo Clinic and our department is they've allowed us to do some things that maybe were a little bit outside of the norm. We asked if we could start doing simulations and we would bring in actors. That was something that hadn't been done before, and it's become a staple for our training.
Mayo Clinic is a teaching hospital. Everyone here does a really great job of teaching, whether it's from the physicians to the residents or RTs teaching the residents. Our physicians are making sure that we're heard as well as, the nurses are heard. They just want to make sure that we're giving the best care to our patient.
We have one of the largest respiratory therapy departments in the country with over 200 individuals.
I think Mayo has plenty of career advancement opportunities, whether it be working as a transport therapist, working as a PEDS transport therapist. We have hyperbaric here that respiratory is very involved in. We have our level 1 trauma center. I mean, there are so many different entities. The list goes on of things that respiratory therapists can do here.
The warm and welcoming culture that Mayo provides with employees, it really makes all the difference in employee mental health. Having that constant support system, not even just in your own family outside of work, but as soon as you walk in the door, knowing that all of these people are here for you makes all the difference.
The Rochester community is great. I would say a lot of people enjoy the various seasons we experience here in Minnesota.
You see a lot of people, different countries, different ethnicities. You'll have a lot of recreation and activities. Another thing that I like Rochester is commuting is very short.
Why is this a great place to work? It's different every day, and I don't know how else to say that. It's not monotonous. You're going to have different challenges every day, and some days are harder than others. You're going to have days that test you mentally and emotionally, but you're going to have days that are full of reward, and you're going to have memories that last a lifetime, and it's the people you meet. It's the patients you meet. It's the care you've provided. It's kind of all those things rolled into one. That's why I'm 21 years in, still here.